Hi, guys. Welcome back to another episode of Decoded Healthcare. We're excited to do an interview this time for our podcast episode. We have one of our classmates from Hopkins joining us, Amanda Stephenson. And Amanda's here to talk more about her experience working within healthcare consulting and working within the access field of healthcare consulting specifically. All of us have various experiences with internal, commercial, federal consulting, and we thought this would be a great opportunity to just learn from each other and learn more about what's happening within the healthcare landscape in the US. So, without further ado, I'm going to pass it over to Amanda and she can do a brief intro.
Right. Thanks so much for having me, guys. It's great to see you again. Basically, since I've started my kind of consulting career, I've worked almost exclusively on Access and pre-Epic implementation projects. So really what that means is trying to figure out how to get the patient to the right provider at the right time and the right location. And it gets a lot more complicated than that, but that's the general gist of it. And we build scheduling algorithms, we look at capacity, template design, and we look at how to translate the algorithms into referral orders and patient care journeys. So it's a quick overview. I work at PwC, like a big four consulting firm. We work with a ton of different companies and organizations and health systems. Right now, I'm at a large Midwestern academic health center. So that's kind of the context of my project.
Very exciting. I think access is a huge thing that AMCs and health systems in general are dealing with. What are the biggest hurdles you're seeing within providers trying to get to their patients? And what is like the major pain points of your clients specifically?
So great. There's a few like big ones that we always try to address. The first I will say is lag times, kind of looking at from when a patient first calls in or gets a referral, how long it takes from that date until the actual appointment date. And what we see is that the longer the lag time, that there's a higher patient loss rate. So it's really important that not only for patient care that we're not losing those patients, but also from a financial perspective that those are referrals or patients that we're losing to competitors. So the other aspect is unconverted referrals, people who are being referred to the health system particularly or provider specifically. And then because of the wait times or because they have so many hurdles in scheduling, that they just never make it to their appointment or they go elsewhere. So that's another really big aspect that we're always trying to address.
Yeah, that sounds like really important to the healthcare landscape in just terms of patients getting their care. I guess the next question I have is what are some of the strategies that you implement or have thought of that is common in the healthcare landscape for expanding access?
One of the biggest is building questions into Epic or your EHR of choice. Most of them are Epic at this point that can drive scheduling automatically based off a referral order that a provider puts in. It's going to direct a patient one way. Or if it's a question that's more patient facing, when a scheduler calls in, they can ask the patient that question and it will automatically bring them to the right subgroup of providers. So we're never having incorrect referrals or we don't have that instance where a patient shows up to say a general neurologist when really they needed to see a movement specialist. That's a really big patient dissatisfier. So things like that. Another big one is making sure that there's centralized lines or that we don't have too many phone numbers out there, ways to contact an office because patients just get overwhelmed with that.
That sounds great. I can personally say it's really frustrating when you're a patient in the healthcare system and you're not going to the right providers or your first step is not going to the correct group. So I think that's something that definitely needs to be worked on. How are you guys predicting success? I feel like this sounds like a big undertaking, Epic implementation wise. Or so what's your team doing to make sure this is successful? And are you seeing other health systems or AMCs model the work that PwC is doing for your client?
I would say like we have a few metrics that we can kind of tell. There hasn't been a go live yet, so we're still kind of in the process of where we're building this all out. But what they'll look at is those lag times, new patient loss. But another big one is really important on the financial side of things is surgical yield. So part of our algorithms are to prioritize patients that have a high surgical yield to get them in faster, and to try to not require referral or record review or anything like that beforehand. And then from kind of a build perspective and stakeholder on the project, it's just physician engagement and provider engagement. The algorithms are really complicated and nuanced, especially in some of the specialties like neurology or neurosurgery. So getting them on all of our calls and getting kind of their stamp of approval throughout the process has been a huge indicator of success for us. And to answer your question on other places, um, PwC, we've done some of this work before and we're kind of pioneering the way, but this project that I'm on is kind of the first of its kind.
It's pretty cool to hear. Yeah, definitely a lot of cool work in scheduling and registration. Is there work being done in the call center, like in terms of registration and access, or is that not what you kind of work on right now?
There is some, I'm not on that specific work stream of work, but I know that there is stuff that we're doing. It's pretty large transformation, but it's another important aspect of it, from just that very first step with the patient.
No, definitely. And because I'm from the health system side, and we have huge call centers that route calls from patients to different departments, inpatient versus ambulatory. There's a lot of different ways that the calls could go. And with the, recent advances to technology, I feel like there's a huge opportunity to automate a lot of that, as well as, enable the actual employees of the call centers to operate more efficiently.
For working in access, I feel like all of us here have a general idea of what access is because we're in healthcare. But for people who are listening that don't necessarily know what access entails, for somebody who may not know exactly what access is in the healthcare setting, it's not just simply people getting to appointments. There's a lot more things that go into it. So could you just give us like a quick, brief explanation of what that all entails?
Yeah, I would say access primarily, like you said, like it's at first is can a patient actually get scheduled? Um, but it's also that they have the opportunity to find the right providers. It's not that they just get scheduled with their primary care physician. It's that when they need a specialist, that there's one there for them and they can make that transition of care from their PCP, or even sometimes if they have a problem, they don't have a PCP, that's not another barrier for them to see a provider, and get integrated into a health system. And then kind of from the provider standpoint of it, it's looking at access is looking at kind of your load balance of new patients and established patients and making sure that providers aren't seeing only their established or return patients. That way they can get those new patients in.
Taking that a step backwards, which that was really helpful to kind of set context, what does current state pre-PwC coming in look like? And how are patients reacting? Like when they're taking time to give them a provider or they're not going to the right provider, does that deter patients from getting care at your client? Are they going to other places? Do you guys have any knowledge on that?
Yeah, I can't get too much into specifics, but I would definitely say that right now what's happening is that patients are just calling the wrong people, they're getting scheduled at the wrong places, and they show up to appointments that it's either a burden for them to travel to. It's a state that's pretty rural, so a lot of times they're traveling 2 or 3 hours to get to the right place, and then they show up there, and maybe it's not even the right provider, or maybe that it's a right provider, but they really think that someone else would be better served for the patient. So stuff like that can kind of turn people away if they're already kind of skeptical or not super involved in their healthcare, then that's definitely a factor.
Nice. And I kind of want to switch gears and talk about the other part of your job that you mentioned with Epic implementation. Um, I guess for those, give a quick description of what Epic really is, and what it's capable of and what it's used for, and then kind of love to hear about what you guys are doing with it and how PwC is working to help systems implement that technology.
I would say this is kind of the part of the project that we're just getting into, so I'm still learning, and Epic is such a big organization company and they have so many different tools, but at its baseline, kind of simplest version of Epic is the idea of it as an EMR or electronic health record, where all the patient's records are electronic and they can have a patient portal. Epic's is called My Charts in most places, I feel like nowadays. But they also have a lot of tools kind of on the back end that patients don't see for referrals, order placement, labs. There's things with scheduling. There's a ton of stuff like Epic has a million tools. And we're leveraging a lot of them, but we aren't actually doing the Epic implementation. We're kind of doing some pre-work. So a lot of that technical build is still handled by Epic.
And would you say change management's a big thing that you guys deal with? Or is that not in your purview of implementing it and also, you know, helping the system or provider use it? You're more of that pre-work and setting like the foundation.
I would say that ours really is a lot of the change management, especially because we're kind of preparing the providers and the clinics and leaders for what future state will look like. And we're tying in this access work with it. So we're kind of getting to those challenges or those discussions before Epic is. And so it is a really, really big change, not only kind of with this access perspective and these um, mindsets we want to have, also this huge shift in technology and kind of a learning curve there. So I definitely say that's been a huge aspect of it. And we have a pretty large team and leaders who are really good and very integrated with the health systems leadership. So I meet almost every single day with either a provider or some admin leader to talk through what we're working with, and we just keep them very closely aligned to what we're thinking. And so far, that's been working pretty well.
Um, that sounds awesome. I feel like we have a lot of context on Access and Epic and the really cool work you're doing and PwC is doing. Um, what are your thoughts on like AI merging with Epic? Are you guys doing some work there? Is there more agentic capabilities coming up? Anything you can discuss over there?
It's something that we hear all the time from the providers that they want. They say, "Oh, AI could do this for us," or like, "Why can't we just build in this AI tool?" But we're still not really at that point where at least not that I know of, that Epic has anything where it'd be ready for our client in this situation. I think one day it could definitely be used in kind of some of that record review or referral management. But right now, no. But it's definitely something that providers and admins are asking for.
No, totally. We're seeing this like huge trend of AI in action in healthcare. So very interesting. And I know we're kind of centering this episode on access within a health system, and we actually have Rohan working within an AMC himself. Rohan, do you have any thoughts on challenges that you guys have had with access or work you're doing?
Yeah, I mean, there's always work in access. We're always trying to capture more of the patient population. Right now, I work at a community hospital, so one of our main missions is to support the health of the community. And we have initiatives that go into the community in different school-based clinics, as well as internal operations initiatives. For example, like automating parts of the call center, or some of the work that Amanda has been talking about with Epic and scheduling and how to make that more efficient. But what I've really been seeing is the potential of artificial intelligence, as we've been talking about, and the potential of automating some of these. But the issue with artificial intelligence in healthcare is that a lot of times these tools are uh, generic because they come from startups, or they're within Epic and they have a lot of there's a lot of technical debt in healthcare, and the change management piece is usually the hardest part. So it's kind of interesting to hear Amanda also kind of echo that. But yeah, I would say change management has really been the biggest piece of implementing any of these technologies.
No, super interesting to see that it's just a theme across these health systems in the United States. And I feel like there's a lot of robust change that's happening, which is super exciting. Kind of shifting gears back to what Amanda said in the beginning about how they're doing a lot of things with scheduling, templates, capacity. Can we touch a little bit more on capacity, Amanda?
Yeah, definitely. I think this is the part that I found really interesting. that we're just getting into. It's really looking at like different levers that we can pull on the provider kind of template side. And a template is just the provider scheduling template. Each provider's template has certain slots that a patient can be scheduled into. And so part of what we're doing is looking at how many, say, new patient slots or established patient slots a provider should have, and things around their template, like their visit links, modifiers if they're doing in procedures, how we can compare those to their competitors or people or similar like-site organizations, and seeing where we can kind of push there. So big things that like affect capacity would be their new patient mix, their visit links, if they're overbooking or double booking. And so we really try to push providers where it makes sense clinically. And also with them, we know we don't want to burn out any of our providers, but that's a huge way of kind of increasing access from a back end perspective.
That was really helpful, good context. It sounds like you guys are doing some very, very exciting work. So we appreciate you giving a little bit more detail. Um, Wanting to just shift the conversation and opening it up to everyone as a whole on experiences within consulting in general. I know a lot of us have different fields of consulting experience. So I know some of our listeners are kind of early careerists, so maybe talking a little bit about pros of the jobs and things that are happening in the industry now would be awesome. Firas, can I kick it off to you?
Yeah, of course. So my consulting field is a lot different than what I've been hearing in this conversation. Um, for those of you who don't know, I work at Booz Allen, and so that's a federal contractor. So I work in the more agency and federal government space, and instead of kind of what Amanda and Rohan do as more provider and internal consultants, working with specific systems and providers, I'm kind of working more at the agency level. And so kind of helping broader organizational work rather than independent providers. But one thing that I heard that's similar, I feel like across everyone is AI. We're seeing a huge push in the government towards AI, um, within healthcare, outside of healthcare. So AI is definitely taking over, especially in healthcare. And I would love to talk to Arushi about this because I know she works in a very fast-paced environment, and I want to hear her thoughts.
Yeah, absolutely. And that was great context for us. I think a lot of us forget how vast healthcare is and how many moving parts there are. Like, there is the federal side of things, there's commercial. And if you flash back to one of our first podcast episodes, we talked about the big triangle within healthcare, providers, payers, and life sciences. So super cool to hear how Amanda and Rohan are more in the provider space right now and looking at things like access capacity. And then Viras is doing federal work, but kind of more broad and hitting a couple different of those points. I currently am working more in the payer slash health plan side. Um, so a little bit different than the provider work where we're working more on health plan member experiences. Currently, I'm on a engagement where we're looking at a claims assist manager and figuring out how do we make it more smart? How do we make sure it parses through Medicare, Medicaid, and commercial? Because there are very different requirements for each line of business. So I think the theme and everything is AI, right? We're all touching different points of healthcare, but AI is kind of the solution and the ticket that everyone's looking for. And I think it's especially interesting from my perspective is every other industry is kind of really adopting AI and healthcare is a little bit behind, but we're getting there. We're doing more work. I think that's what consultants are for mainly as well. So it's cool to see that. Rohan, can I punt to you a little bit and you can chat more about what it's like? I feel like you have a closer look working on the grounds within a hospital, so would love to see what's up in your hospital's list for AI.
Yeah, I mean, AI is obviously a huge topic. It's right now the tip of everyone's tongue. Really, people are talking about it this much because of how expensive the cost of labor is in healthcare. In an average healthcare system, around like 40 to 50% of revenue is spent on labor expenses. And you can imagine with how razor thin the margins are in healthcare, which the average is like 4% margin, there really is an opportunity to alleviate some of that financial burden, especially for like nonprofit healthcare systems or academic healthcare systems. So our system, we're an academic community healthcare system, and we have AI in various departments, but they're just tools. We have Epic, we have a variety of tools in Epic, and other departments as well has other tools. So some of these tools help with access. Some of them are administrative backend, and there's a couple that are on the clinical side, like in our radiology practice or for imaging. So for uh, access and for throughput, one of the most important tools in our system has been Lean Toss. So Lean Toss looks at case management and bed management throughout a healthcare system and uses AI to predict availability to move patients from bed to bed, and that really helps with throughput, making sure patients are getting to bed, their beds at the right time, and moving care like throughout the day. That's one tool. Another tool that's been really important is all the ones in the Epic suite. So Amanda was mentioning that Epic has a variety of AI uh, integrations that she helps integrate, and we have a huge Epic team that also uh, that helps integrate some of these tools into our operations, and they do a great job. So between the outside vendors and the Epic tools, we have a pretty good AI strategy, but the real challenge is really just training the workforce, because these tools are only as good as the people using it and how well they're trained.
Thank you, Rohan. I think that was like a wonderful round robin of just some synopsises or snapshots in our lives. I think my takeaway from this is consulting is so vast, and it's especially so vast in healthcare. And it's really cool to hear what everyone's doing. Thank you, especially to Amanda, for giving us more insight into what it's like at PwC, what your work is doing, and access. I think that's a huge, huge hot topic in today's industry, especially. And I know I sure learned a lot. Um, I think this was a great conversation. This is all we had planned for today. We're gonna wrap up. Firas, any closing thoughts?
No, I just wanted to thank our listeners one more time and also Amanda for joining us today. I know we're all super busy, and I appreciate you carving out some time to speak with us. And I'm sure all our early careerists out there will really appreciate this conversation. So thank you so much, Amanda, and thank you all for listening and stay informed and stay well. We'll see you in the next episode.